Hello everyone, Dr. Brent Kimball here. I'm going to just take a minute and go over recovery expectations from cervical disc replacement. So you may be a patient of mine, you may be a prospective patient. This is important for you to understand, especially if you're undergoing disc replacement. Now, if I'm not your surgeon, you may need to talk to your own doctor about what to expect about the recovery process. This is how I treat my patients, and if you're one of mine, again, this is what I'll expect you to follow. So disc replacement surgery, as typically done in my practice, we perform it in an outpatient surgery center setting. Every level takes about an hour, hour and 15 minutes. So after surgery, you'll be going home likely 90% of the time the same day, whether it's 1 or 2 or 3 levels. Typically what I'll do is I'll put you in a cervical collar, a hard collar. Now, the collar is indicated really to help you remember not to do too much with your neck. The muscles in the neck, after we've reconstructed and opened up the disc and added some space and height to your neck, the muscles can get a little irritated, so I find that it's really helpful for my patients and everybody around them for them to have a little bit of support, especially when you're in a car or a vehicle. You better not be on a motorcycle because that'd be really bad. Never want to see someone in a collar on a motorcycle, so don't do that. Wearing the collar when you're walking around or in the car is a must. Now, my caveat is that I want you taking that collar off every 4 or 5 hours and then putting your neck through just a very simple passive range of motion, just like this, just nice and gentle, up and down, nothing really. I don't want you cracking it, I don't want you tweaking it. If it hurts, I don't want you doing it. The point is you can use this disc right now, right once the surgery's over, okay? It's not fully healed, it's not gonna be fully healed for months, but you're gonna be moving it as the weeks and days progress, okay? So the first week you can expect to have some soreness in your neck. If you have arm pain or hand numbness or arm weakness, those things should be improving immediately. Now, if you have weakness, sometimes that takes a little while to get better, so be patient. As far as the neck pain and tightness go, it's often okay or common for it to be a little tightness in between the scapula. That will generally ease with time, so we'll usually have you taking anti-inflammatory medication, Advil or Aleve, while you're recovering, in addition to any muscle relaxants or pain medication that we've prescribed. That's totally different from fusion, so if you're a fusion patient, totally disregard that statement. It's different because you're a disc replacement patient, okay? After we get through week 2, typically we'll see you at around 2 weeks, and at that point, we're gonna take that collar off completely and have you kind of roll back into normal activity without a collar, all right? Your wound should be healing really nicely at that point. You should be able to get into the bath. Hopefully at day 1, day 2, you're already getting the wound wet and in the shower. That's totally fine. Now, once the skin is healed, you can now, kind of get back into a bathtub or totally submerge it. Make sure the wound's totally healed and let us take a look at it before we give you the okay on that. As you're advancing into weeks 2 through 4, we're going to start increasing your activity and probably start to get you back into physical therapy for mobilization of your neck. Not a lot of strengthening at this point, but at 4 weeks, we probably want to get you into physical therapy. So ask us about that. As you're advancing into weeks 8 weeks and beyond and getting toward 3 months, that's the point when we're going to start increasing your activity more and more. Now, I probably won't have you get back on the ski slopes at that point, or onto a trampoline, but I want you to start feeling more and more comfortable doing more and more things. Can I go to the gym? People always ask, can I do, can I walk? Can I use, a treadmill? All those things are great. I'd like to stay away from heavy impact things. So if you're running, prefer you to be on a treadmill or an elliptical. If you want to do an exercise class, that's totally fine. Yoga would be fine as long as you're not totally over, tweaking your neck or bending it. You don't want to be causing pain at this point. As you're advancing into and toward that 3-month period, we're going to get another set of x-rays to confirm that the bone is totally healed and all the implant is in proper position. There is a fine balance between allowing the bone to heal and keeping the neck muscles mobile and strong. The last thing that I'll say is that as you approach to come to my office to end up getting spine surgery, typically what happens to a patient is they start degenerating in their activity, meaning you're doing less and less. So your neck muscles, they weren't like they were 2 years ago or when you were 20 years old. Don't think that just because after the spine surgery you're going to all of a sudden jump back in time. That's not the case. So use some sense, realize that you're going to have to rehab your neck back to a place where it's going to be in prime time active, ready to do whatever you want. So again, talk to your provider. If I'm your provider, this would be super helpful for you, and hopefully it's answered some questions for you. It's not uncommon for patients on occasion to have some nerve root irritation after we've manipulated the spine. If that's happening, call your doctor, let us know. Sometimes people need some additional medications to help them get through that period. Thank you very much.